purpose of the harm reduction program is to prevent the spread of diseases in our communities such as HIV and hepatitis C. Kentucky is actually one of the highest rates of hepatitis C in the nation, and we can do better. The program that we participate in is a one-to-one exchange. That means that people bring in one dirty needle for each clean needle that they want to get in return. That actually helps because it keeps people from just dropping needles on the ground or throwing it away in the trash, and that helps protect the community members such as law enforcement, sanitation workers, maintenance workers, keep these off the street and make sure that no one is affected by a needle stick. The program, as you know, runs Thursday afternoons from noon until 4. We're not really that flexible on it, so if you do have a need, then we really need you to come in from noon until 4 on Thursdays. So if I can get you to sign your initials here. Remember, you only have to do your initials. You don't actually even have to sign your full name. Great. Now do mine. Now, the front here we have some information that I'm going to get from you, but it's going to be very simple. Mostly demographic information. Nothing's going to be able to be tied to you. I'm only going to get your initials, your date of birth, zip code, and just a little bit of other information such as that. When people come to the harm reduction program, they often ask on why it's important to not reuse needles multiple times, even if they are the only person that uses that needle. Well, if you look at this graphic here, you can see that the first time that you use the needle, it's very sharp and it's very clean. But even after a single use, you can see that it starts to get bent and a little bit more damaged. After about 6 uses, you see that it's actually been pretty messed up, and that's a lot of places that bacteria can hide and lurk. And whenever you start having those kind of problems, that's when you start getting skin abscesses and have other problems such as blowing veins in your arm. Okay, now that we've already got you checked in, we're going to make sure that you have what supplies you need so that you can bring the needles back safely. We're going to give you one of these little containers here, and that's going to make sure that whenever you put your needles in it, they are going to stay safe. The lid does seal, so you won't be able to reuse this container, but when you bring it back in, we will dispose of it properly for you so you don't have to worry about that. After that, you're going to want to get some kind of a laundry detergent bottle. This has thick plastic so the needles won't be able to poke through, and that's going to keep you and your family a little bit safer. Also, it has a narrow top, so the needles aren't actually going to accidentally fall out. So that's another good thing about it. A lot of people try to bring in 2-liter bottles that are full of needles, but that plastic is not thick enough to prevent the needle from poking through. So you want to make sure that you try to use something with a very thick plastic, preferably with a narrow lid, so it doesn't just have needles falling out all over the place. As part of the harm reduction program, the Barren River District Health Department has partnered with Life Skills to also offer a naloxone training for any participant. We've also been working with law enforcement, local EMS, and also the fire department to make sure that this medication gets out to the public. What it does is whenever someone is in an opioid overdose, it actually makes the brain lose all the opioids, and it fills those spaces up so that it can't get back in, and it brings you essentially out of the overdose. Hopefully that'll give enough time for paramedics and EMS to come and make sure that everything is okay and get you the medical treatment that you do need. This training is available for the general public. Anybody that has a need of this medication, either personally or because of a family member or a friend, does qualify for it. So if you are interested, then we are trying to get more and more classes available just so we can get it out to as many people as possible in the community. We also have free HIV testing and hepatitis C testing. So if that's something you're interested in, just let us know. You currently already know your HIV and hepatitis C status?
I do.
Okay, well, like I said, we can get that taken care of for you. It is a free service that we do, just so you know your information and know whether or not you're at risk of spreading any of these to your friends or family. In addition to the HIV testing, we're also trained to do hepatitis C testing. Right now, we're waiting for the state to send us test kits, and we will get that rolling as soon as possible. And then that way you'll know your risk for both hepatitis C and HIV. The hepatitis C process only takes about 20 minutes. So while you're waiting for the HIV test results, you can also get your hepatitis C results basically in the same amount of time. People who are in a harm reduction program are 5 times more likely to enter into a rehab program, and they're also more likely to be successful when they do enter this program. That's partially because the people in these harm reduction programs realize that there is a risk associated with the the drug use that they're doing, but a lot of these people don't have someone that they can speak to about getting treatment. They just simply don't have the resources or the friend network that can help. And by coming into the harm reduction program, they can develop the trust with our staff, and hopefully that'll encourage them to get treatment. Because sometimes all these people need is to know that there's somebody out there that does care about them as a human being and want them to succeed. And that's oftentimes the first step into getting into treatment.